Well, there's a new illegal drug being detected in Maine that health experts say increases people's risk for overdose and severe withdrawal.
It's called medetomidine. It is an animal tranquilizer not approved for human use. Though we don't know how much is present in Maine, our Katie Delaney is here saying that clinicians are preparing to see more people affected by it. Katie, I knew I should have practiced saying that drug's name.
That's okay. So that drug is medetomidine.
Thank you.
We'll get it next time. Now, I spoke with some public health officials here in Maine, and they say new drugs are constantly being added to the illegal drug supply, like fentanyl, then xylazine, and now medetomidine. This drug lowers blood pressure and heart rate and can cause someone to stop breathing in an overdose. Bangor's public health director, Jennifer Gunderman, tells me people need to be more aware that a medetomidine overdose looks different than an opioid overdose. She says healthcare professionals in Maine are now preparing for this. Naloxone, a medication that reverses opioid overdoses, does not reverse the effects of medetomidine. But since this drug is usually mixed with opioids, Gunderman says it's still important to use naloxone and take other steps.
What's important is that a person who is administered the naloxone really stays vigilant about the person's breathing and to provide rescue breathing and call 911. So the steps are pretty much similar, except that really sort of making sure that rescue breathing is happening.
As for people who use drugs can reduce their risk, drug test strips for medetomidine are not widely available like fentanyl tests are, for example. Maine Access Points, a harm reduction organization, says it does have test strips for medetomidine, but they need to be done at one of its locations across the state because analyzing a sample of this drug is more complicated. I'm Katie Delaney, News Center, Maine.